Hello, this is Dr. Park. When the nipples are large, they can be noticeable under thin clothing, which can be a source of self-consciousness. In particular, unmarried women with large nipples may be mistakenly perceived as having breastfed before, potentially leading to unwanted impressions. On average, a woman's nipple measures about 10 to 12 mm in diameter and 8 to 10 mm in height. However, the size and shape can vary greatly from person to person. So, what can be done when the nipples are too large or have an irregular shape? The first correction is height reduction. If the nipple is tall, dome-shaped like a mushroom, or resembles a droplet, we leave an appropriate height and remove only the excess skin, then suture the area. We do not remove the entire nipple, only the skin is trimmed and the internal structure is preserved. Incisions are made along the border between the nipple and areola to minimize visible scarring. The second is diameter reduction. If the nipple is too wide, we remove wedge-shaped sections from around the nipple and suture the area to make it narrower. The wider the nipple, the more skin is removed to achieve a balanced result. The third is shape correction. If the nipple is elongated vertically, star-shaped, asymmetrical, or splayed, we trim and suture the skin to create a rounder, more natural appearance. For spread out or flattened nipples, we tighten and suture the base so that they project more naturally. If the center of the nipple is split or overly wide, we remove the affected area and bring the tissues together for a more compact shape. Most nipple reduction procedures involve adjusting height, diameter, and shape all together in a three-dimensional approach. Post-surgery, there is little to no pain, and patients can return to daily activities almost immediately. The nipple has excellent blood flow, which promotes fast healing, and due to the natural folds, scars are rarely visible. Lactation function is preserved. Except in cases where the nipple is severely split, we preserve the milk ducts, so even unmarried women can safely breastfeed after the procedure. Many patients choose to undergo breast augmentation or correction along with nipple reduction. In such cases, the nipples may appear more prominent as the breasts become larger, so the nipple size must be considered as part of the overall surgical plan. That concludes today's explanation about nipple reduction. Thank you for watching UB Plastic Surgery's YouTube channel.